Hello, friends. Welcome to the Veterinary Life Coach podcast. Today, I have an exciting guest for you. Her name is Philippa Pavia. Dr. Pavia is the National Director of Soft Tissue Surgery and Surgical Oncology at Thrive Pet Healthcare. Dr. Pavia is also, or Pavia, I'm going to say it wrong.
Pavia, you're good.
Pavia, I had it right the first time? Okay,
Yes,
I love it.
you got it.
I told her before we started that I was going to keep saying it wrong, so I told her to correct me. She's also Thrive's Vice President of Medical Operations in the Central Group and works with senior leadership to cultivate a positive hospital culture, support team growth and development, and ensure exceptional medical care and client experience. Dr. Pavia, did I say it right?
Yeah.
Has extensive experience in clinical and leadership roles across various veterinary hospitals. She holds an undergraduate degree in English literature from Yale University and a veterinary medical doctor degree from the University of Pennsylvania School of Veterinary Medicine. As a diplomat of the American College of Veterinary Surgeons, specializing in small animal surgery, she is dedicated to making veterinary medicine a sustainable career for all hospital team members. And I'm delighted to have her here with me. Difficult pronunciation and all, because everyone knows that I struggle with that. Welcome to the podcast. I'm so happy to have you.
Thank you for having me. I'm really looking forward to this conversation.
Yeah,
Whenever I get an opportunity to talk about these things, I'll never turn it down.
Oh, great. I love it. I love that you're excited about it. And I think this is a really interesting subject. We talked a little bit slightly before the podcast, and I think you guys are going to really enjoy this. So, my first question to everyone on the podcast is to tell me their veterinary story, because I like to hear how people got started and how they got to the career that they are in now.
Absolutely. So I think for many of us, becoming a veterinarian was never a choice for me. It was something that was almost in my DNA. Maybe it was because my grandfather was a cavalry officer in the Italian military. I don't know where it came from,
Cool.
but everybody in my family was obsessed with animals. And when I was a very small child, I would be kept sort of quiet, which was difficult for me, by giving me a box of Kleenex, a roll of Scotch tape, and all of my stuffed animals. And they all had very gruesome injuries that needed to be bandaged. I had a stuffed horse who had pneumonia. It was a whole thing.
That's awesome.
So I don't know where it came from, but I was always kind of down that path. And so I ended up being an English lit major in undergrad because I actually felt that this was probably my last chance to study something non-veterinary related.
That's an interesting
So
thought, right?
yeah,
You were like, I need to study something different just because.
I thought that the entire rest of my life was like a closed door. For the rest of my life, it's all VetMed all the time. That changed, but giving a little preview there.
Right.
But I also spent a lot of time riding horses when I was in college because there were club teams that were affordable. So maybe it was also because writing a paper was a little easier for me than doing an organic chemistry problem set. That might have been part of it. But that was probably my first experience of failure, actually, is I had this idea that I could be an English lit major and then also do pre-med and pre-vet at the same time. Turns out really was not going to happen for me, that I needed to fully dedicate myself. So that was a really good learning experience for me. And then I did a year of post-bac, and I finished my pre-med requirements, pre-vet requirements at a smaller college in Manhattan called Hunter College. And it was a really good experience. So then I went to veterinary school at University of Pennsylvania. I was planning on being an equine surgeon, but I'm 5'3" and don't do well in the cold. And so that clearly was not necessarily going to be the right career path for me, but I still love horses. And then I did my internship and residency at the Animal Medical Center in New York City as well.
Nice.
And then I got my dream job. I got my dream job as a surgeon in a practice in downtown Manhattan in New York City, my home. And I thought, that's it. This is my career. This is where I'm going to be for the rest of my life. I bought an apartment so I could walk to work, right? So talk about commitment.
Right.
And then I realized maybe about 5 or 6 years in that part of what I had loved so much was the process of learning and becoming. And it was a very difficult conversation I had with myself, with my family members, with friends and colleagues of what's next, right? I thought that being a surgeon was it for me, and I was going to be fulfilled, and unicorns were going to dance, right?
Right.
Um, and I wasn't sure what it was. So I started kind of dipping my foot into other parts of veterinary medicine. I started supporting the internship program. So we had 22 interns in 4 hospitals. And so I was the intern program coordinator. And I loved that, but that wasn't quite it. I became medical director, and that was closer. I really loved being a medical director and supporting my team. But every time I learned something, it opened another door of, oh, I don't know enough about this to really truly be supportive of my team. And that's
Right.
kind of what always drove me, was asking questions and feeling like I needed to know more to be a better leader and to do more for the people in the clinic. And so I ended up stepping out of a medical director position and taking a role in a veterinary startup, a general practice and urgent care startup. I joined at hospital 7 and I stayed until hospital 45. I spent
Wow.
2 years with them. And I was practicing as a surgeon in a general practice, and then also learning to become a little bit more of a veterinary leader, doing medical excellence and then also medical operations with that group. And once I felt like I had my sea legs outside of the clinic, I then joined Thrive Pet Healthcare in February of last year. And now, although I don't have clinical shifts, I spend a lot of my time traveling to our over 100 hospitals in the central region, giving lectures, hopping into surgery, supporting with training, along with, of course, kind of the broader business goals and supporting from that perspective. The last step, maybe it's the last step, I don't know, in my veterinary journey, as I'm
Probably
halfway through
not.
my, who knows, is I'm halfway through my MBA at Rice University.
Nice.
So, so that was one thing that I felt was something we were missing in veterinary medicine, was more veterinarians who were interested in business and were capable of kind of crossing that divide and communicating with the folks making the operational and financial decisions and the clinical teams. And I think that's kind of the secret sauce. And you as an owner, you would have
I
you
agree.
understand that
Yeah.
intrinsically,
Business is
right?
so important, and not every veterinarian gets it.
Right. And it's scary. And I still
Mhm.
find it scary. I sit down in an accounting class and, I had that moment of panic, like I'm back in trigonometry in 8th grade. Um, but that, I think, is kind of where I've hit my stride. And I'm really, really passionate about how we can work together and get what we want done. We can have a successful practice. We can have happy team members who feel like they're being compensated appropriately, their hours are fair, their benefits are good. I think it's all possible. We just have to communicate better with each other. So that's kind of
Right,
my journey.
because you have the corporate types that
Yep.
aren't veterinarians that want the
Hmm.
business to run well. And then you have the
Yep.
veterinarians, and there's a disconnect. So your idea is, if I have an MBA and I'm a veterinarian, I can
Yeah.
kind of bridge that gap between the two, the corporates and
Yeah.
the
That's
doctors
right.
on
And the
the
more
farm.
conversations I have on both sides, the more I understand that everybody kind of has each other's best interests at heart. There's just not always an understanding of how to get there and how to communicate that.
Sure.
And a lot of the time you can thread the needle and end up having a win-win situation, but there's just some barriers to understanding. So
Yeah.
I think we can
Yeah.
do a lot better. Yeah.
Yeah, that's exciting.
Mm.
I always wanted to get an MBA. I don't know why. That was one of my other things. I was like, should I be a life coach or go back and get business degree? I'm kind of like you. I like to change it up. So setting new goals.
Hmm.
So let's talk about that a little bit, because that
Yeah.
is something that's so important to our profession, is understanding that, we all kind of wanted to be veterinarians, and that meant kind of one thing to us, whether it's the equine track or the small animal
Hmm.
track. But then we get into practice and we want more, and you obviously did. So let's talk about that a little bit, because you said that's one of your
Absolutely.
passions to talk about, is career paths.
Yeah. Well, and I think the thing that I had to clarify myself was ensuring that whenever I was making a change, I wasn't moving away from something, I was moving toward it. And so when I hear sometimes that somebody says, I just want to get off the floor, my question is, well, what do you want to do?
Right.
What is inspiring to you? And what is it about being on the floor that's making you want to move away from that? Is clinical practice still your passion, but there are certain things getting in the way of that?
Mhm.
Because I think we also culturally we have this idea that growth has to be change or has to be vertical growth, right? So changing out of your current role into something different. And I've also met incredible technicians, clinicians who have been doing, I guess you could say, the same role for 20 to 30 years, but they have grown and they have an incredibly different impact in year 20 than they have in year 10.
Right.
And I would love for us to have a different understanding of growth that sure, my path looks a little bit, like a crazy ladder with some of the rungs cut out, and like falling
Right.
off of it half the time. But that's not the way it has to look. It can look more like one of those, escalators in the airport where you're getting somewhere, but it doesn't mean that you're changing where you are. So that's another thing that I'm passionate about is making people happy in the role that they're in and feeling like they have personal growth within that role or maybe outside of that role, so they can stay in it. And for some people, maybe that means that you are perfectly fine doing the same clinical role, but you learn to fly airplanes, right?
Yeah.
Or
Pivot
you
to a
have,
hobby. Hmm.
right, or your kids are your passion outside of work. And you don't need to kind of be grinding at work because that might be actually more relaxing to you than being at home. I have a good friend who's a general practice veterinarian, and she says, oh, I love going to work. It's so calm. I can control the environment. She's got two young boys. So, whatever it is that works for you, I think we need to have more conversations about it, though, early on in veterinary school, that success doesn't look like a linear path.
Right.
Um, yeah,
Well, and there's nothing wrong with you if you are searching. A lot of us feel like
that's
we
right.
went to vet school, it was such a hard accomplishment, we graduated, we have our dream, and
Yeah,
then 5 years later we're lost again. We think there's something wrong with that. And I think it's kind of a natural human thing to keep
yeah,
wanting to strive. And it doesn't mean that you don't like vet med anymore. It just means that you need to adjust something in your life
yep,
in order to
absolutely.
continue to grow. And
Yeah,
that's a big part of it, right?
yeah. Well, and that reminds me of lots of conversations I've had with my brother. So I knew what I wanted to be when I was, what, 6 or 7. My brother wasn't sure. And the period of time for him after college was like a little challenging, right? He spent some time as a paralegal. That wasn't it. He spent some time, working in a bookshop. Well, that wasn't quite it. And it was a very stressful time for him. But he also then learned those skills of how to know himself, how to try something, realize it wasn't for him and pivot and still be okay internally that he still had an identity without his job being his
Yes.
identity.
Yeah, that's a big
Um,
thing, right?
and now he's a book editor and his favorite thing is books. And, it took him some time to get into that role, but that was what he was made for. And he learned those skills of discerning what the right role was for him. And some of us, we never had to do that, which in a way is a luxury. But then 10 years later, we're kind of going through that almost delayed adolescence of who am I outside of work? Like,
Yes.
what does this
Yeah,
mean?
that's so true.
Um, yeah.
That is so true. And I think we get hung up on the idea that if we do pivot or if we do add or change, that we're no longer that identity that we grew up thinking we always were. I've had veterinarians talk to me and say, I was in clinical practice for 10 years and I realized it wasn't for me. And then I went into industry and now, people don't think I'm a vet anymore. Like they're like,
Yep.
oh, you're not a vet anymore. They'll say that to me sometimes now that I'm a life
Hmm.
coach. Well, what do you do? I'm a veterinarian. They think you're still in the hospital and you're not so much anymore. Yeah, and that's part of our identity too.
Yeah. And I think that's something that we internally within our organization have to kind of talk about and work on first. And then, of course, the outside world too. But my brother-in-law was trained as a lawyer, worked as a lawyer. Then he went into crisis management consulting. He can still say, I'm a lawyer, I have a law degree, even though
Hmm.
that's not what I do. So
Right.
yeah, I think that's something that we also put on ourselves. We in veterinary medicine are our harshest critics by
Sure.
far.
Mhm.
And that it's very interesting to kind of talk to other people and watch that psychological journey as they start thinking about doing something outside of the clinic and how hard on themselves they are and how much anxiety they have. And then a couple of years later, looking back and saying, man, I really wish I hadn't been so anxious about it because now that I'm on the other side, I realize that I probably should have made this decision earlier and shouldn't have given myself so much mental anguish along the way.
Yeah.
Um, yeah.
So
So
how do you
that's
counsel
one thing
people
that
to do?
coaching I think could be really helpful.
Okay, so that would be a way to get somebody to coach you through those
Hmm.
decisions. I find that a lot when I
Yeah.
coach people is and that's how I learned to do this is I got coached and kind of figured out the
Yeah.
path that I wanted to go on. But how do you recommend that people get over that worry that other people are gonna be disappointed? You know, because we have families that, oh, my daughter's a
Yeah.
veterinarian or my son's a
Yeah.
veterinarian, and and then you're telling them you want to leave that job. Um, how do you get over that?
It's hard, and you're not going to be able to eliminate those people from your life.
Right.
I still get that, right? When somebody asks me what do you do, and I say I'm a veterinary surgeon, there are people in my own family who will laugh and say, "Are you now?" But I think part of it is knowing within yourself that the decision that you made is right. And for me, it's still about being part of this community
Mm.
and feeling like I'm actually contributing more to veterinary medicine in the role that I'm in currently than I was as a surgeon. There are many talented veterinarians and many talented veterinary nurses and on the floor, right? And there was a time when I realized, I'm pretty good at TPLOs, but I know a lot of people who are good at TPLOs, probably better than I am at them, right? And
Yeah.
what is it that I can do for veterinary medicine that I might be uniquely capable of doing? Maybe, yeah, maybe the fact that I have an English lit degree, maybe the fact that I'm actually really interested in the numbers and operations, maybe because I just love people and I'm really interested in human psychology and communication and how we can overcome these traditional barriers. Um, that yeah, maybe I can be more of an asset in this role than I could have as a surgeon. Are there times when I miss it and I think back to all the years of training and I love being able to hop into the operating room when I can? Of course. But I think that's a big part of it is that we are cures. Most of us, if you take our personality tests, most of us fall somewhere on a conscientious, analytical, nurturing, whatever test you want to take.
Right.
And I think as long as we're still fulfilling that internal duty to ourselves, that can make some of the external criticism feel a little bit less important. Um, but also having somebody who's in your corner, somebody who's done it before. It doesn't have to be a mentor who's done exactly what you have, but somebody who's made a similar type of difficult decision. And they can be, the angel on your shoulder that balances the negative thoughts on the other side.
Yeah, because I think that what I try to teach veterinarians from what I'm doing is that it's really difficult to manage your own brain because you don't always know what it's telling you. I call it the Chihuahua brain because it's always so scared and frustrated and freaked out. Um, but it really does help to have somebody, a mentor or a coach or a therapist or somebody help you get in there and really figure it out. Because otherwise, you just think that there's something wrong with you if you want to change careers every 5 years, like you have. You think, well, what's wrong with me that I can't be happy where I am? But
Yep.
it's very much a normal human trait to want to grow, at least people like us that are high achievers. And there's nothing wrong with that.
No, but I will say that sometimes it can go too far in the opposite direction. And I find myself sometimes seeking achievement as its own goal,
Mm.
and that doesn't keep you warm at night. And
Right.
so that is definitely I'm very conscious of that and saying, okay, you're allowed to do this last degree. And
Is
then
that what you have to tell
maybe
yourself?
yes, yes, indeed. I tell myself this is the last one. but also what is the purpose of that? Are you doing it because it is something you want to learn, or are you doing it because you want accolades, letters after your name, whatever that is? And making sure that once you achieve whatever it is, you pause and reflect and say, okay, did I actually get what I thought I was going to get out of this? Or did I get something better? Or maybe is this actually not what I wanted in terms of the end, but it was just the process of achieving that really, made me feel like I was doing well. And so I do think that we can go too far in the other direction, feeling like we need to change just because then it feels like we're going somewhere.
Yeah, and I think on some level, that we feel when we don't feel well, when we feel frustrated or stressed out or burned out or whatever it is, we think that the next thing is going to fix it. Like we
Yeah.
chase things because we think it's going to
Hmm.
feel differently when we get there. And this was something that I was taught along the way that it kind of was a light bulb moment for me. It's like you chase the things because you're chasing a feeling that you'll get when you get it. And then once you get it, then that feeling is gone. It's like that. And now you're chasing it again. And I think that
Yep.
happens to a lot of us in vet med is okay, we go to undergrad and then we go to grad school and then we graduate as a veterinarian and we think it's going to feel a certain way and when it doesn't feel that way or it feels that way for a year and then you're like okay now it's just a job that then you start chasing other things which isn't really what you want to do. You want to really not chase the feeling but actually you chase it for the reason, not
Yeah.
really the feeling that you get, but like, what is the purpose of this? And if you can stay in the purpose, then you're going to be fulfilled longer and you're going to get burned out less. Do you agree?
Absolutely. 100%. Um, the other thing that I've found has been a great sort of bolster to burnout is who you're working with.
Mm,
And so that when you make a decision about staying or leaving or changing or not changing, that the people are probably the most important thing. And that I see a lot of sort of self-fulfilling burnout talk, and it feels good in the moment to sort of indulge in that, oh, veterinary medicine is in such a bad place. Like, what are we
right.
going to do? We should all quit. We should all this. Oh, corporate, it's terrible.
We don't get paid
And
enough, yada, yada. Yeah.
right, right. There's a lot of trauma bonding that happens in our profession, and some of it is totally fair. We go through a lot. It can be incredibly stressful. Um, but it's then not being solutions oriented.
Right.
And I think that also fuels well, we need to change, we need to move, we need to do something different. Now, here is not the place. Well, how about you actually, work on your culture? And it starts from within, it starts from you, and say, all right, what can I do to make things feel better within the constraints that we have, and to kind of get a little bit of a bigger picture. I also think that now this availability of information across the industry can be very good, but it can also fuel it. I
Right.
always tell folks in the business side, veterinarians are not fueled by money, but they are fueled by parity and fairness. So if
Mm.
they hear that somebody with their skills, or maybe not as many skills or experience as they have, is getting paid significantly more, that's going to be a problem for them. But it's not about the actual dollar amount. It's just about feeling valued and about fairness. So that's something that I think we can do a lot more about, talking about, and also being transparent about the finances of the business and say, we can't pay that, and here's why, and actually show team members, and this includes technicians and assistants, front desk team members. Let's be really transparent about the business, so that nobody's thinking that somebody's pulling a fast one on them and that they're going
Right.
to get more somewhere else. I
Yes.
think it's really important for everybody to understand why things are the way they are. And it's not some big bad corporate overlord. It's just literally the way business works.
And yeah, it's just basic economics.
Yeah.
Yeah. And that's true. Most people, I don't know why we don't teach it in high school or whatever, but most people have no understanding about how economics works and how the world works in that way, and that makes it difficult,
Mm-mm.
especially in vet
Yeah.
med, because we're not at the top of the food chain when it comes to making money,
Yeah.
right?
No, we definitely aren't. We definitely aren't. But we've come a long way. We've come a really
Oh,
long way. I mean,
absolutely.
I look at all the studies of like the average starting salary when I finished vet school versus the average starting salary now,
Yes.
and it's good.
Yes.
We've done better.
We've
Yeah.
made progress for sure. Oh yeah,
Yeah.
especially since when I started. Everybody would cringe if they knew how much I made at my first job.
Yeah. Oh
But
gosh.
you have opportunities. Owning a practice, being a practice
Mhm.
leader, getting into corporate, doing things like
Yeah.
you've done, you have opportunities to make money if that's your
Yeah.
goal, right?
Absolutely. But I still think, we have so much opportunity when it comes to technicians, obviously.
Oh yeah,
And that we haven't cracked the code on
not
because,
quite.
in human nursing, that's a wonderful career path,
It's a
like very
great career.
sustainable. They make great money as nurses.
Yeah.
And that is something that we still, as a business, need to figure out how we can keep that horizontal growth path for technicians
Yeah,
without pushing them out of the business entirely when they want to make a certain, dollar amount higher than
that's a
that.
real
So
issue. Yeah,
yeah,
for sure. Talk to me a little bit about the culture piece, because you touched a little bit
yeah,
about, having nice hospital cultures rather than the toxic,
yeah,
like that word particularly, but toxic hospitals.
yeah,
And you
yeah,
work with hospitals on that specific issue, correct?
yeah,
Yeah.
absolutely.
Tell me your
And
take on that.
oh my gosh. Well, every hospital is its own sort of ecosystem. They're all different. And it also
Mhm.
depends on kind of what type of care they're providing, what challenges there might be. And I was very, very familiar with the specialty ER environment where it was often a lot of people who had done a lot of additional training and they needed very specialized teams and very specialized equipment. And then the cases were extremely high stress. So that was its own type of specialized team building and making sure that the people you have, particularly in a specialty team, I had the wonderful opportunity of rebuilding a hospital. So I got to hire a lot of the doctors and a
That's
lot of the
awesome.
team members. And so we were able to sort of create this like dream team of people who had balanced profiles, right? So I would work with a critical care specialist who had a little bit more of a traditional surgeon personality, and he was a driver. He was like, we've got to cut this case, we've got to do this, we've got to do this. And I'm much more of a, let me read all of the literature from, 1972 until this very day. And we balanced each other incredibly well. And the things that stressed us out were different, and we were able to communicate about that. So I think that can be really, really helpful is being transparent about the things that do stress you out and the
Mhm.
way you like to be communicated with. Um, at the beginning of kind of learning about leadership, I found this incredibly hokey of the, but how would you like for me to give you feedback? Right. I felt so awkward saying that. But the more I had those conversations, the more I realized that it was incredibly different.
Mhm.
Um, and that I thought that I was a good communicator, but actually, I was probably doing a very poor job for 30% of the team. And yeah, a great job for another 30% and a job for the rest. So creating that culture is asking questions and you have to be proactive. You can't just say, oh, I'm nice to everybody. Culture's going to follow. It's about actively having conversations about teamwork and then in the moment, there are specific actions you can do to drive culture, like morning rounds. Easy, right? If you have inpatients, that as an action, a defined system and process immediately improves culture because you're giving your team, your nurses, your technicians, your assistants visibility into what's going on that day. And then they have the opportunity to give input. Immediately, that changes your culture on the team. And my nurses, my technicians constantly said, hey, Dr. Pavia, would you actually prefer if we do, Fluffy Jones first? Because that means we can turn over the ortho OR. And every time I'd be like, that's a brilliant idea. Yes, yes, we can do that. And
Right.
so that shifted that traditional sort of, and I hate to even call it a power balance, but it shifted that. And they immediately felt like they were part of the team. So debriefs morning and evening. After something bad happens, This is something that comes from human medicine, and we've adopted in veterinary medicine as well, the debrief. So you have a CPR that doesn't go well. Don't just go to your separate corners, lick your wounds, and think about, well, gosh, like John just really wasn't fast enough with the intubation. Like I think we could have kept the
That's
pet
the whole
alive if
problem, right?
right. So you go through it, and you have to have an environment where you can talk about bad things that happened in a non-punitive, non-judgmental way. My other soapbox that I'm very passionate about is medical quality and adverse event reporting and prevention. And the best hospitals that I walk into are the ones, and with strong culture, are the ones where they're very open about the bad things that happen, and they can talk to each other about it. And so I think the way you create system and process to deal with the things that cannot be systematized, right? The crazy stuff that happens in veterinary medicine. Um, yeah, culture doesn't just happen. You have to be thoughtful about it. Doctors' meetings, teams' meetings, having agendas, check-ins with your doctors. I learned a lot about being a medical director without really knowing what that meant. And regular check-ins, medical record reviews, system and process, so nobody is surprised when, you say, hey, I was looking at your record the other day and I noticed that, you forgot to put in the ultrasound charges. And they're like, what are you looking at? Why are you looking at my record? And instead this is a process. I will always be looking at records. You're welcome to look at mine as well. And then we're
Right.
going to talk about it. So
Sure.
anyway, long way of saying that you can create systems so that you have um, dedicated time for culture. You don't have to call it that. It can be time for medicine, but at the end of the day, what you're doing is creating dedicated time for culture.
Right, right. And what if you have like problem employees? I hear that a lot where people have one or two people that just keep stirring the pot and they're having a hard time dealing
Yeah.
with it. They don't want to confront them, which, is another subject all on its own
Mm.
of fear of confrontation. But do you have any of those kind of situations that you've dealt with that you have like a couple of tips that people could start with? They have
Yeah.
a person that's a problem.
Yeah. Yeah. I mean, I,
Or
I, I don't love conflict either, right?
I don't think anybody does. I
Yeah,
say that I do. I always say, "Oh, I love a good fight," but I love it from the standpoint of the of solving it. Like I like to solve
right.
problems. So for me, a good a good battle or a good conflict is an opportunity to resolve something.
Right.
And so that's why I say I love it. So, but I get nobody likes to be in a fight situation or situation where there's
Yeah.
conflict.
I think the way to think about it is about the impact on the rest of the team. Because
Mm,
if you're in a position where you're having these challenging conversations, it's probably because you're a leader or you're a de facto leader. You don't have to have a title to be a leader. You can just be seen as a leader. So you're having those conversations. And as uncomfortable as it is for you, think about the impact it has on all the other people you care about that you're working with. So that's helpful for me.
right.
The other thing I always remind myself is that everything is worse in anticipation, and that
Yes.
once it's done, it's never as bad as you thought it was going to be. Never, ever, ever.
Yep.
Um, but also there are, of course, there's tons of books about crucial conversations, giving feedback, thanks for the feedback, all those books. And it's great if you've read them, but if the person you're giving the feedback to hasn't,
It
sometimes
doesn't work.
sometimes all those, yeah, sometimes it's a little bit more challenging. But I would say my issue tends to be over empathizing. That I think it is very important to put yourself in the shoes of the person who's the problem employee, because in their head, they're not the problem. Everybody else is the problem.
Exactly.
So it's extremely important to have that conversation and ask questions. I think that is my number one recommendation for having these challenging conversations is ask questions. And specific questions, because how are things going? They're going to say, fine. Say, I
With
noticed
an
that there was a little
attitude.
bit of tension. Of
Right.
course, like, why are you bothering me? But, and say, I noticed that, and keep it very specific and time bound. So I hate to make the analogy, but we're veterinarians. It's okay. like when you're training a dog or a horse, the correction or the praise has to come immediately after the behavior, right? So if you wait 2 days later, your memories are all faulty. You don't know what exactly happened. So, ideally, it's within the same day or the same week. Say, I noticed that you had, there was a little bit of tension when you were interacting with, Dr. Jones. Um, can you tell me about that? Like, I could feel it, and it seemed like you guys were both uncomfortable, and I'd love to help you. Can you talk to me a little bit more about what happened during that interaction? And hopefully that will be specific enough, but also open-ended enough that you're not leading the witness. You're not saying, you were rude to Dr. Smith.
Yeah. They're not feeling it.
Um, right. Right, right. And then if they really aren't recognizing their own behaviors, sometimes you have to then be quite pointed and say, um, I'm glad you didn't feel like that interaction went poorly, but here's what I observed. And then, the other important thing is to not triangulate. And so it's important to say, not Dr. Smith told me you were being rude, but say, I've observed this behavior. Would you like to tell me about that? Because I think some people are very afraid of having those conversations because they don't want to throw somebody else under the bus. So, as much as you possibly can, taking it upon yourself.
It has to be personal. Yeah.
Yeah.
Because the he
Yeah.
said, she said thing never works.
No, no,
Yeah.
it does not. It does not. And I'm in that position fairly frequently, having some difficult conversations about medical quality, and I'm not in the hospital. So, thankfully, with over 100 hospitals, it's not that frequent. Otherwise, I'd be more concerned. But that's a challenge that I have as sort of a remote support team member. And so, what I do is I make sure that I read the medical records. I speak with every single member of the care team so that I'm not anchored on one person's opinion. It could be very easy for me to talk to just the medical director or the practice manager and say, oh, well, that's what happened, right? Because they're the leaders in the clinic. But it's
Right.
equally important for me to talk to everybody who is involved in it before I decide what actually happened. And sometimes you can never tell what actually happened, and that's okay too. You just need to make sure that that type of thing doesn't happen again.
Yeah, because everyone has their own perception. And
Yeah.
unless everyone's in the same room, things are gonna look different to everyone. Like the
Yeah.
facts are gonna be a little bit skewed.
And a lot of the time, everybody has something they could be doing differently or doing better.
Right.
But our chief operating officer, Dr. Triolo, who is an internal medicine specialist, has this term negatrons.
Mm.
And he has a very strong perspective that you have to get negatrons off the team. And I love that because I think in veterinary medicine, we've been so squeezed for staff for so long that particularly if somebody has strong skills, we've sort of allowed behavior that has been tainting the rest of the team to go on just because we're afraid that we're not going to be able to fill that role again.
Mhm.
And I really appreciate the support all the way from an executive leadership team saying, nope, we don't need anybody that badly if they're bringing down the rest of the hospital because we're going to lose way more people if we keep that person on the team. And so that's, I think, something that has changed in my career for sure.
Right.
That we used to tolerate a lot more of that sort of behavior and not even investigate it, not even figure out the whys and try and fix it, but just like
Mhm.
step away and say, well, we can't talk to them because we might anger them.
Because they're crabby or something. Yeah, and
Yes. Yeah.
I've been guilty of that in practice, and I've also been guilty of over, like you said, empathizing with that
Yeah.
person. Like, well, I can change
Hmm.
them, I can fix them. If I just coach them enough, I can make them
Yep.
less negative. And
Yep.
that will bite you in the butt too, because sometimes you can't make people change unless they
Yeah.
really, really want to. And so then you just tolerate behavior that you really don't want in your practice.
Yeah.
And it's hard on
No,
the
it's
rest of the
it's
team.
really it's really really challenging. But again, I think we as an industry are getting better about that. We've become a lot more professionalized when it comes to sort of how we give feedback and how we do performance management. I mean, I remember early on, you only knew how you were doing if someone threw something at you. Right? Literally,
Or yelled
sometimes.
at you. Yeah.
Yeah, absolutely, absolutely. And so now the fact that we have formal performance reviews, yeah, does it feel a little corporate? Yeah, okay. But so is having a formal, HR or people team. That's corporate. Is that a good thing? Yes, it is. That's here to protect everybody. Um, so yeah, I think veterinary medicine has come a long way with a lot of those things.
Yeah. So do you have any specific, I don't know if you want to call them tips or tricks, but on for veterinarians or
Mm,
technicians or somebody that's working in the clinic that is at that crossroads where they're feeling very unsure of what they want to do next or
yeah.
whether they should stay or they're feeling burned out or not as happy as they want to be. Do you have any tips
Absolutely.
for those people?
Absolutely. And it depends where you are in your career path and
Yes.
what your financials look like. Not
Right.
everybody has the ability to take a 3 month sabbatical and,
Most
decide
people
what they want to
don't.
do with their lives, right?
Right. To do it on the
So
side.
yeah, but I've actually had really, really good advice that you can give 70% instead of 100%. Where it matters, right? Not when you're taking care of a patient or that or
Right.
talking to a client, but most of us just give our all to our jobs. And if you're
Mhm.
at that point and you feel like you don't even have the bandwidth to think about what's next, go through your schedule and your mental schedule and think, what can I take away? What have I been really grinding? And I could just pull back a little bit and give myself space to think about what it is that I could be doing differently. And then I've certainly seen this. People get very frustrated when they, go on Indeed or whatever it is, LinkedIn, and they say, well, there's no job description for what I think I want to do. Well, no, there might not be. There truly might not, that job might not exist. And it might not be a full-time job. It might not yet be a paying job, even. So just talking to people, thinking about what it is that would make you really happy, and then seeing where you can do a little bit of that and try it out. So, for me, I started doing a little bit of consulting on the side for de novo practices opening up in different countries. And just a little bit of a taste of is that something that I enjoy doing, that sort of intersection of business and medicine. And I didn't get paid for it, but I really enjoyed it. And now I do sometimes get paid for consulting, and that's great. But that was a way for me to see if that was something I loved. I was very fortunate that I actually took a job that seemed much more similar to what I was already doing. It was sort of medical excellence in surgery. And then while I was in that role, I kind of started being in rooms and having conversations that were more on the operations side. And even though that wasn't my job, I slowly started, being able to support in that way and then moved into it kind of organically. And I think that is something that we just have to be open to the possibilities, have a lot of conversations. Of course, if there's somebody who has your ideal job, send them an email. They will absolutely get on the phone with you. People are so willing to support and mentor and talk.
Yeah.
Um, but if it's not something that already exists, just try it out and in a very low risk way if you possibly can.
Well, and that really will help your mental health because it stimulates that part of you that wants to grow
Mhm.
and it's low risk. If you don't quit your
Yep,
job and try to move into another job, but you do something on the side, like you're suggesting, you're going to figure out where you're passionate and be
absolutely.
able to build that up before you risk losing your whole paycheck.
Yeah.
Yeah,
And you don't have to leave behind the things that you still do love about the job you're doing now.
right.
I love talking about surgery.
Hmm.
I, when I took on this job, I said, will I still get to do continuing education? Will I still get to, go to conferences and make sure that I'm still doing that part of it?
Right.
And just stand up for yourself. Say what it is that you value. And the vast majority of the time, people will say yes.
Yeah, and that's a confidence thing, I think, a lot. We forget how powerful we are. I'll say that to some of my clients. I'm like, aren't you a doctor? They're like, oh, I'm not this, I'm not that. I'm like, you're a freaking doctor. That's important. I think we forget that
Yeah.
we are intelligent and strong and we can do big things.
Yeah. And
Yeah.
that type of vulnerability, and once you are in a position that people would consider a position of power, keeping that transparency and openness that nothing was easy and that you had to kind of stumble your way the way everybody else has.
Yeah.
And then, yeah, anybody who wants to talk to me about taking roles outside of the clinic, I'm always happy to talk to anybody about that. And I'm sure most people feel the same way.
Yeah. So tell me a little bit about Thrive and what, because you said you've
Yeah.
been there about a year, right?
Yeah.
Tell
Yeah,
me
absolutely.
about the company and why you love it and what it even is.
Yeah.
And tell people.
So, absolutely. So, Thrive is a really, really interesting group. It's very large, over 300 hospitals, as well as other sort of business to business entities. So, Thrive also has a radiology provider called Vital Rads, also has boutique eye care, dentistry, dermatology, and cancer hospitals as well, kind of standalone.
Yeah.
And then Thrive has general practice, urgent care, ER, and specialty medicine within all of its regions.
Nice.
So we get a little bit of everything. And I love that because within our regions, we have people who can support and provide context on anything. So if you're a general practice veterinarian in Austin, you can pick up the phone and call Pet Specialists of Austin or Heart of Texas, both Thrive hospitals, and you can have a criticalist or a surgeon or an oncologist or whomever on the phone with you, and you all work for the same organization. So I think that's really special.
Yes.
For me, in the role that I'm in, it's a fascinating sort of puzzle of an organization because some of the hospitals are de novo, sort of built from the ground up by Thrive, and then some were acquired by the prior parent company called Pathway. And so, talk about culture and different culture and challenges of making sure that the people who have been working at Prairie State for 20 years still feel like they work at Prairie State and
Right.
that Thrive as an organization is really supporting them, but they still get to be Prairie State with everything that they
Themselves.
care about. So that was a great sort of opportunity and challenge for me was how to support hospitals that look so, so, so different. And then also have the opportunity to work with a leadership team, a senior leadership team that gets it. I mean, our COO is an internist. My boss, our chief medical officer, is a neurologist.
So it's run by
We have Right.
veterinarians.
And our CEO, who isn't a veterinarian, gets it. And he comes from human medicine.
Right.
I partner with my group vice president, who also has a background from human medicine. So when there's people who are not veterinarians at Thrive, there are people who have chosen to be in a veterinary organization because it aligns with their purpose and their mission. And
Mhm.
that's really important. So yeah, it's people, right? You choose where you work because of the people. That's
Right.
what
I
I did.
love that. And you
Yeah.
love it there so far. You've been there a
Yeah.
year. It's a great
Yeah.
place. So what have I not asked you that I should have? Is there
Oh
something
gosh.
you wanted to cover that we didn't cover?
I don't think so. I think we've covered a lot. I mean, I
Yeah,
could
we
talk about
did.
this forever. We could spend
That was
another
my
hour
bad.
talking about
Well, and
technicians,
you're
right?
welcome to come
Because
back. Welcome. I
I'd love
always
to.
say that. I say that on almost every podcast. If I'm having a good time, I'm like, if you want to come back and we'll do another hour, we'll do another hour.
Oh my gosh. Yeah, I could talk for an hour about techs. I could talk for an hour about surgery training and how we don't do that coming out of veterinary school. But I
Okay.
think for this topic, we've covered a lot of ground.
Okay, I love it. So if people want to find out more about Thrive or about you, or they want to ask you
Yeah.
any questions, where can they contact you?
Yeah, absolutely. So definitely on LinkedIn. The beauty of having a very challenging name is it's also unique. So I'm the
Yes.
only
It's certainly hard
Philippa
for me to
Pavia.
remember how to say it.
I am the only Philippa Pavia, as far as I know, anywhere. So you can find me on LinkedIn. Also, my email is my first name dot my last name at thrivepethealthcare.com. So easy to get in touch with me that way. And then, of course, if you want to see where our Thrive hospitals are, just thrivepethealthcare.com, and we got a lot of them. So hopefully there's
Yeah,
one near you.
300 you said. That's awesome.
Yeah, yeah.
Well, it's been delightful meeting you and learning all about you, and I love your excitement for our profession. And I think that's what everybody needs to hear.
Well, thank you so much for having me. This has been great.
Yeah, it's been really fun. Thanks everyone for listening. I'll talk to you again next week. Thank Philippa. Philippa. I know I'm going to keep messing up your name. Have a beautiful week, everyone. Bye.